If you are over the age of 50 and you are taking vitamin B12 right now, I need you to stop what you are doing and listen to me very carefully, because there is a very high chance that the way you are taking it is doing almost nothing for your body. I know that sounds alarming, but stick with me, because what I am about to share with you today could genuinely change the way you feel every single day. I am talking about your energy levels, your mental clarity, your mood, even the tingling and numbness that some of you have been dealing with in your hands and feet for months or even years. And the frustrating part is that many of you are already spending money on B12 supplements. You are already making the effort. You are doing the right thing by trying to take care of yourselves. But the problem is not that you are not taking B12. The problem is how you are taking it, when you are taking it. And in many cases, the form of B12 you have been sold is one that your body can barely even use. And nobody is telling you this. Your doctor probably handed you a recommendation, maybe wrote something on a notepad and sent you on your way. The bottle at the pharmacy looked fine. The label said vitamin B12. You thought you were covered. And yet here you are, still feeling tired, still feeling foggy, still wondering why this vitamin that everyone says is so important does not seem to be making any difference at all. My name is Melani Sander, and I have been practicing medicine for a long time. I have seen thousands of patients walk through my doors, and I can tell you from real clinical experience that vitamin B12 deficiency in seniors is one of the most underdiagnosed and mismanaged issues I encounter. It is not because doctors do not care. It is because the standard approach to B12 supplementation has not kept up with the science, and most people, including many healthcare providers, do not understand the nuances of how this vitamin actually works inside an aging body. So today, I am going to walk you through everything. I am going to explain why B12 is so critical, especially as you age, why the most common forms of supplementation are failing you, what you should be taking instead, how to time it properly, what foods actually help, and the warning signs that your B12 levels are dangerously low, even if your blood work says you are fine. Yes, you heard me right. Your blood test could say your B12 is normal, and you could still be deficient at the cellular level. We are going to get into all of that. So please do me a favor and stay with me until the end, because the last part of this video might be the most important thing you hear all year when it comes to your health. Let us start with why vitamin B12 matters so much in the first place. B12 is not just another vitamin on the shelf. It is involved in some of the most fundamental processes in your body. It helps produce your red blood cells. Without enough of it, your body starts making red blood cells that are too large and misshapen, and they cannot carry oxygen efficiently. That is one of the reasons you feel so tired all the time. It is not just age. It might be that your blood is literally not doing its job properly because it does not have the B12 it needs. Beyond that, B12 plays a critical role in your nervous system. It helps maintain the myelin sheath, which is the protective coating around your nerves. Think of it like the insulation around electrical wires. When that insulation starts to break down, the signals do not travel properly. That is when you start getting tingling in your fingers, numbness in your toes, balance problems, and in severe cases, nerve damage that can become permanent. I want you to hear that word again, permanent. If B12 deficiency goes on long enough, the nerve damage it causes may not be reversible even after you start supplementing. That is why getting this right matters so much, and why getting it right now, not next month, not next year, is so important. B12 is also essential for brain function. It is involved in the production of neurotransmitters like serotonin and dopamine, which regulate your mood. There is a well-documented link between low B12 levels and depression, anxiety, memory problems, and cognitive decline. I have had patients come to me convinced they were developing dementia. They were terrified, their family members were worried, and after proper evaluation and appropriate B12 intervention, their mental clarity improved dramatically. Now, I am not saying that B12 is a cure for Alzheimer's or dementia. That would be irresponsible. But what I am saying is that some of the cognitive symptoms that seniors experience and attribute to just getting old are actually being driven by a correctable nutritional deficiency, and that should give you hope. Now, here's where things get really important. Why are seniors so vulnerable to B12 deficiency in the first place? The answer comes down to absorption. When you eat food that contains B12, your stomach produces something called hydrochloric acid and an enzyme called pepsin. These work together to separate the B12 from the protein it is bound to in food. Then your stomach produces something called intrinsic factor, which is a special protein that binds to the freed B12 and carries it to the end of your small intestine where it gets absorbed into your bloodstream. That is a beautiful system when it works. The problem is that as you age, your stomach produces less and less hydrochloric acid. This is a natural part of aging, and by the time you are in your 60s or 70s, your stomach acid production may have dropped significantly. Some studies suggest that up to 30% of adults over the age of 50 have a condition called atrophic gastritis, where the lining of the stomach has thinned and acid production is substantially reduced. And without enough stomach acid, you simply cannot liberate the B12 from food efficiently. It just passes right through you. But it gets worse. Many of you are taking medications that further suppress your stomach acid. If you are on a proton pump inhibitor like omeprazole or lansoprazole or any of those acid-blocking medications for heartburn or acid reflux, those drugs are specifically designed to reduce stomach acid production. That is their job, and while they may help with your reflux symptoms, they are simultaneously destroying your ability to absorb B12 from food. The same goes for H2 blockers like rhinatidine or famotidine.